My skin might bleed a lot or be very scary looking. That's normal for me. People might have a second look or say something under their breath. I couldn't care less.
I honestly have never seen somebody like this. Let's find out more.
My life expectancy was nothing more than 2 to 5 years. I'm Dean, I'm 43, and I live with epidermolysis bullosa.
Wow, he has epidermolysis bullosa, and this is a skin condition where you can get blistering of the skin, but he has a lot more than that.
It's a very rare genetic skin condition. I've still got the same skin as everybody else, but it just doesn't have the binding anchors that hold all the layers together.
In patients who have epidermolysis bullosa, just like you said, the skin actually tends to fall apart. The layers of the skin lack that kind of glue that puts those layers together. And then patients who have epidermolysis bullosa typically develop a lot of blistering of the skin. They can get easy wounds just from literally the skin rubbing against each other and from basic movement as well.
So any sort of movement will create a friction type burn, kind of like sandpaper rubbing against each other.
So if you don't have epidermolysis bullosa right now as you're watching this, do not worry, it's not going to happen to you. This is believed to be due to a genetic mutation, one that can be passed off along to family members, but this is something that typically does present in childhood.
My version is one of the most severe versions of EB. The doctors indicated that it would be better if I passed away sooner rather than later, because the older I survived, the more painful and more debilitating life was going to get.
What a tough condition. So he says that his life expectancy was not very long. It's awesome that he's lived to 43 and appears to be relatively healthy and I hope active. But the reason why this can be very dangerous for people who have it is because when your skin develops all these blisters and openings and non-healings, you can get infections very easily. Our skin, which is the largest organ of our body, acts as a barrier. It basically keeps out bacteria and viruses that can make us sick. But when the layers of your skin aren't fused together, it has a hard time performing that barrier function, and therefore people with epidermolysis bullosa are at high risk of infections that can lead to sepsis, which can lead to death.
For a 12-month appointment, it was always marked with an asterisk to call through and check I was still alive.
Gosh, you really got to hand it to his parents with having a child like this and then raising them. I'm a parent of 2 children, and to think that you don't know if your child is going to be there 12 months later is just a horrifying thought. Now, one question you may be asking is, why are his eyelids being pulled down? It's most likely because that skin itself has scarred in and it's now creating what's called an ectropion or lid retraction. The problem that can happen here is that he can get drying out of his eyes, and that can create permanent damage to the eyeballs and even potentially lead to vision loss. My assumption is that he's putting lubrication over his eyes when he sleeps at night to help keep them moist and prevent infection and once again loss of his vision.
I found out in the year 2000 that I was selected to carry the Olympic torch. I was still wheelchair bound through those years, but I kept sort of thinking it would be pretty cool though to walk with the torch.
So he said he was wheelchair bound. Does epidermolysis bullosa affect then your muscles or your strength? And in general, it should not. So I'm not sure why he was wheelchair bound, unless maybe he had some type of an infection that got into like some of the deeper tissues.
So we got a treadmill. Slowly I became strong enough to be able to stand on the treadmill and walk on the treadmill.
Well, that's great that he was able to become more mobile. Now, what can happen with some people with EB is that they can get fusion of their fingers and even their toes. Because the skin doesn't heal like a normal person's skin, those digits can actually fuse together if you get injuries in between them. And it's possible that that may have happened to him. It also may be a reason why you see that he's got those wraps around each of his fingers.
It was basically the entire town was there to cheer me on. It's still one of the most magical days of my life.
Now, these patients are also at risk for skin cancers, and that's something that a dermatologist would follow these patients very, very closely.
I decided to take on the biggest challenge I could think of, which was moving to Brisbane to set myself up to live independently. People in the community were very scared of me. Nobody would give me even the opportunity to give them my resume and show them what I was capable of doing.
Wow, that is really, really sad. But you see his sweet dogs showing him affection. I mean, I'm a dog guy. You may know that if you follow my social media that we're really into rescuing senior dogs. We are down to one right now, a little tiny, and hopefully we may adopt another one pretty soon. But you know what, in the end, like if you're a dog person, you know that no matter how you feel at the end of the day, you know that your dog is going to love you unconditionally and give you that affection that sometimes maybe people aren't so great at.
I was at one of my friends' places. The two of us got into a competition to see who was stronger. Now I'm classed as one of the strongest power lifters people have seen. My current record is lifting 150 kilos, well over double my body weight.
Dang, good for him. I can't lift like that. So one other thing you may be wondering is what happened to his nails? He's missing his fingernails. So people with EB often do lose, especially in severe situations like his, they do lose their fingernails and toenails. I'm not sure why. I'm assuming it's because the nail beds don't develop properly because it is basically part of the skin. But this is not uncommon in severe cases of EB like his.
My job these days is as a motivational speaker, really passionate about raising the awareness for EB in Australia, and I never would have in my wildest dreams imagined I'd be in this position that I am today.
Now, unfortunately, there is no cure for EB. This is a situation that he's going to have to live with for the rest of his life. And treatment for this condition is essentially what you're seeing with him, is making sure that you prevent injury, and if you do, you want to treat it very quickly. Now, his situation was quite dramatic, but what about a woman who has feet that literally look like elephant's feet? Yes, elephant's feet. You gotta check her out and my reaction to her video right up here. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.